Today, let's talk about one of the most common injuries with athletes and athletic individuals, ankle sprains. Welcome back to another Twins Talk Therapy video. I'm Aaron.
And I'm Adam.
And we are massage therapists. I'm an athletic trainer. He's a physical therapist with a combined 30 years experience in those three fields. So today we're going to talk about different types of ankle sprains, which is one of the most common injuries that occurs with athletes and active individuals. So two different ankle sprains we're going to discuss: the lateral ankle sprain or low ankle sprain, which occurs on the outside, lower outside ankle of the ankle joint. And the other one is considered a high ankle sprain or a syndesmotic sprain, and that occurs in between soft tissue or fibrous tissue in between your tibia and fibula. And it's much more of an involved injury that takes a longer healing time. So coaches are always worried about, is it low or high? When I would have an athlete suffer an ankle sprain, they say it's a high ankle sprain, and that's what they're really concerned about, because that one can take up to 3 to 4 months sometimes
Those
to
high
fully
ankle
heal.
sprains take a lot longer to heal.
The lateral ankle sprain, you can easily get someone back between the 4 to 6 week mark. So it's either half or less potentially, depending on the severity of recovery time, than a high ankle sprain. So Adam, let's talk about the rehab process and the exercises involved with coming back from an ankle sprain.
All right.
So when an individual comes in and wants to determine kind of the severity of the injury with the ankle, to determine if there may be a potential fracture or if it might be just the ligaments that have been sprained, which is pretty common. There's a few orthopedic tests that we will do as clinicians to try to rule out certain injuries and try to pinpoint what the injury is. So as an athletic trainer, I'm going to check range of motion first. So Adam, I just want you to pull your toes back, good, and relax, and then point them in, point them out. So if he has limited motion, it's most likely going to be in dorsiflexion, bringing the toes up, because due to the swelling that will occur with ankle sprains, that is the motion that's typically the most limited afterwards. And so then the next thing I want to do, I'm just going to test his strength. So Adam, push down like you're pushing onto a pedal. Good. Now pull your toes up towards your head, and I'll push in towards the other foot and out towards me. And so then I'm just testing for strength, and I'm going to repeat that strength test on the good side to find out how much strength he's lost or how much pain he's having that secondarily causes his strength to go down. Some of the specific tests to figure out the severity of the injury and where it's located, we want to rule out fractures. So I'm going to do some tap testing on the medial and lateral malleolus, the ankle bones at the ankle joint, and just ask him if he feels any pain above or below or at the site where I'm tapping. Heel bump test, so really bumping the heel while you dorsiflex the ankle joint and seeing if he gets any sharp pain in the ankle itself. You can do a squeeze or compression test where you squeeze the tibia and the fibula together in the lower leg. And what you're checking for here, a lot of people will have pain on the inside of the tibia just from pressure and where people develop shin splint pain. So if they're active, they're likely going to have some shin splint pain. So we're not really asking about that kind of dull, achy pain sensation they may get where the squeezing is occurring, but rather asking them if they're getting any clicking, any pain, any sharp pain lower in the ankle joint itself. So when you rule out the fracture testing, then you want to check for laxity in the joint itself. So you could do the Taylor tilt test. What we would do for that is typically have him lie on his side. So if you want to lie on your right side, and we would check Taylor tilt inversion. So I'm just going to gap the joint and then check to see if I feel some end range or the ligament engaged, and not allow too much inversion or internal motion of the foot itself. If I do feel some laxity or he's saying that it hurts a lot, that could be indicative of the severity of the ankle, of the ligament sprain itself, whether it's a grade 1, 2, or 3. And probably the most important test, we would have him repeat that on the other side to check eversion Taylor tilt test and check for laxity there. And that would be dependent on where he felt most of the pain. If it was on the outside, we would likely do the Taylor tilt test, checking in the inversion. But if he has pain on the inside, you don't necessarily need to do the inversion tailor tilt. Likewise, you don't have to do the eversion tailor tilt if the pain's on the outside. The other one we can do is anterior drawer. So go ahead and just turn over on your back again. And to this, you're going to grab the lower leg, place your hand underneath the heel and cup it, and you're going to do anterior drawer. So that just means you're trying to slide the foot forward. If this translates a lot or moves a lot, or the patient athlete is having a lot of pain, then that could be indicative of the severity of the ankle injury itself. And last but not least, probably the one that the coach is most interested in as far as a positive test when they're concerned about that high ankle sprain is the Kleiger's test. So you're going to dorsiflex the foot, and then you're going to laterally rotate the foot. And what that does is it tries to wedge the talus bone up in between the tibia and fibula, and then when you laterally rotate the foot out, it's going to cause like a splaying of the tibia and fibula away from each other. So high ankle can involve that interosseous membrane, or a thick fibrous band of tissue that goes all the way up in between the tibia and fibula. And if a high ankle sprain occurred, that means the foot went in dorsiflexion and got twisted out, so it splayed the tibia and fibula apart and did some damage to the interosseous membrane, that thick fibrous ligament. And then if you do the Kleiger's test, you're basically repeating the mechanism of injury for that high ankle sprain, and the tibia and fibula are going to splay apart, and it's going to produce a lot of pain for Adam. So those are the orthopedic tests and the evaluation process to determine the severity of an ankle sprain.
All right, so some of the exercises I'm going to have someone that sprains their ankle do initially is just some range of motion exercises. So usually I'll have them scooch forward so that their ankle's off the edge of the table, and they can start by going plantar flexion, dorsiflexion, which is just, we call them ankle pumps, going up and down with the foot. Then they can go side to side, inversion, eversion, and then they can do circles. Go the other way. Also, I'll have the client, for more range of motion exercise, do tracing the alphabet with their foot. And they can go through all capital letters, and then for some variety, go through all lowercase letters. These are some common exercises that most people will do when they sprain their ankle. And if you've ever sprained your ankle and done PT, you probably recognize these. All right, the next exercise we're going to do is working on some strengthening. So we can use a TheraBand and wrap it around the inside of the foot, and Aaron can go into inversion with his ankle and do like 10 reps of or so of those. And he can relax, and the therapist would help the patient in PT, but if the person was doing it at home, they could just hold it themselves. They would just have to hold far out like this. This one's actually would be easy for them, just doing plantar flexion, and then they could put the band around their other foot to do eversion. And the main one they would need help with, and the therapist would hold to have them do dorsiflexion. And at home they could tie the band to something to pull against. So those are some band exercises for strengthening. So moving on from range of motion and strengthening exercises with the band, then we will go into closed chain exercises. You'll have the patient on their feet. So the first exercises on the table were open chain, and then closed chain we're having weight bearing, so we're advancing to the next level of therapy. So I will start Aaron doing some heel raises. We need to strengthen the calf to stabilize the joint. He can rock back on his heels and lift his toes up to work dorsiflexion and standing and weight bearing. Then what we do is, if he needed to, I could be here to give him some balance to hold on to, and he would do single leg stances. We'd start working balance. A lot of times in a PT clinic, we'll have the patient hold on to a counter or something too. After the single leg stances to test balance and to work on balance are done, then you can up the ante a little bit more, make it more difficult by getting an unstable surface with this Airex foam pad and Aaron could get up on there and then do, he's going to a single leg stance, but he could also do the heel raises and toe raises initially on both feet to get used to that unstable surface. And as he gets done doing some strengthening on both feet, then he can go to single leg balancing on there. And then he's progressing even further, doing a single leg heel raise. So that is some exercises we can do for that. And then we're gonna, another one, once they're getting good with strengthening and balance, they could get a little slider there. And the bad ankle is the right one. So his left foot goes on the slider. He'll go into flexion, abduction, sliding out, and that's forcing his right foot and ankle to bear all his weight and hold balance as he goes in multiple directions. And he goes at some oblique angles to the side. And those are some good exercises for an ankle injury. Some of the balance and the slider exercises you may not want to do at home initially in the first months of an ankle injury, just because you don't want to be alone and have a fall. But the other stuff we were doing, range of motion, band exercises, those are good to do at home as well.
And then one other way you could advance the AirX pad exercises with single leg a little more is by introducing a ball with this. And so while they're doing single leg balancing exercises, Adam, as the clinician or practitioner, can start tossing it to me, and I have to maintain my balance while he's throwing the ball in different directions. So this is a way that you can just use this foam pad to continue to advance this exercise. And all these exercises, there's ways to make them more difficult or to back them off in severity, depending on how your patient is responding to them.
All right, guys, as always, please like, share, and subscribe to our channel and hit the notification bell so that you're alerted anytime we post a new video. And you can also reach out to us if you have questions or ideas for new videos you'd like us to do at twinstalktherapy@gmail.com.
Feel free to leave comments in the comment section below the video. And as always, take care. We will see you in the next one.
Thanks for watching.
We'll see how that looks.